which is a great segue into the last component of our webinar today. And that is, and of course, the most important part, and that is really the resident perspective. So I'm pleased to introduce Dr. Zahra Merali, who will share that with us. Dr. Merali.
Thank you. So I'm a PGY3 internal medicine resident at McMaster, and I've participated in several virtual medicine clinics over the past couple of months. Next slide. So I'd like to take you inside the mind of a resident. So just a couple of pearls. So first of all, residents, we're very eager to learn and adopt virtual care. We know that moving forward, this is going to be sort of the next new thing that we're all going to be using, and we want to learn how to incorporate this into our future practices. When residents come to you, they're going to have varying amounts of baseline experiences. So particularly thinking about PGY1s, some medical school curriculums may have adapted in the past couple of months to add in a bit of virtual care learning, while other medical schools may not have. So really it's going to be a grab bag of experiences that you get from your learners this July and August. I did want to share some anxieties and fears around virtual care. So first, we'll talk a little bit about just sort of general confusion and what's that like from the perspective of a resident. And then particularly many residents, especially your early learners, are going to be very anxious about supervision levels with virtual care, which we'll get into. And then finally, I think all residents right now with both COVID and with virtual care, we're really worried about gaps in our learning and in our medical education. So we'll talk a little bit about how to address that. Next slide. So my first pearl, residents are super eager to adopt this modality of care. So engage your residents when you're starting up your clinics. At baseline, we are maybe known as the tech-savvy generation. So you can ask your residents within your department about, let them know about your plans and see if any of them have any tips or advice or would like to help you start up your clinic. And then important to think about as you're forming your clinic, what is the sort of standardized way that you'll assess feedback from your residents in terms of acceptability and feasibility of the virtual care aspects of your clinic. Next slide. So then I did talk about some baseline differences in baseline experiences. So how can you address that with your learners? I think the first step would be to talk to your program directors or the heads of your departments because there may be some sort of standardized curriculum for all learners coming to you. So for example, at McMaster, we have an internal medicine virtual care task force. And one of the jobs of this task force is actually to help out with an academic half-day experience to sort of log on and register everyone to OTN and to teach all the residents PGY 1 to 3 the fundamentals of virtual care. And then, of course, it's important to reach out to that individual learner that's coming to your clinic and assess their baseline knowledge. They might be someone like me who's done a couple of months, or they may be a new PGY1 who hasn't done any virtual care at all yet. Something that might be easy for you to do is to have sort of a standardized template email with the materials and tips that you have found useful for your virtual care clinics to send out to residents, or even perhaps a Dropbox or something that takes a bit of the work burden off of you, but can still provide the learners with sort of a standardized materials that they can read through. Next slide. So I'll take you through a typical week that I had on a subspecialty virtual care block. So on a Monday, I may go into hospital and sit in a cubicle next to my supervisor, and we'd both be calling patients over the telephone, and I would review right away. On the Tuesday, I might be at home, in my own home, calling people via OTN, and my supervisor would be in their own home via OTN. And then on the Wednesday, I might go into another clinic where we see some traditional patients, and then we call some patients over the phone. So as you can see here, just Monday, Tuesday, Wednesday is getting very confusing for the learner, like am I at home, at the hospital? So just the general confusion that comes with learners who are with different supervisors during different days of the week is amplified with virtual care. So how can you address this? Communicate with your learner beforehand, like we've been saying. Particularly as a learner, I want to know what's the location of my clinic, what modality of virtual care are we using, because for me, I've used OTN before, but I haven't used Zoom Health, so that might be something that I would struggle with. How often or when are we going to check in with each other, and how will we review with each other? So just setting those expectations early can really help the general confusion of a resident learner. Next slide. I think this is a really big one that we've been trying to really highlight, especially because as PGY1s come into residency, they have the weight of the world on their shoulders, and they're already worried about supervision during face-to-face interactions. So if you think of a PGY1 learner going into a traditional clinic, I go in and I meet my supervisor for the first time. We talk about how the clinic will run and set some sort of baseline, how everything will go. Then I go see my patient in my own clinic room. Suddenly I'm really worried about my patient. I go to my supervisor, knock on their door, and ask for help because I'm worried about this patient. That's all very natural, and it's very casual, natural for us to do in a traditional clinic. But if you think about myself as a PGY1 learner at home alone with my supervisor at home alone, it becomes maybe as a PGY1 a lot less natural to think, my staff is there to support me and to make me feel safe. So definitely, I urge you to think about how you're going to make your resident learner feel supported and safe in that sort of maybe artificial virtual care environment. And the other thing to think about is how are you going to supervise and teach a PGY1 versus a PGY3 or fellow? Perhaps a lot more direct observation will be required for a PGY1, while with a fellow, perhaps you'd be able to allow them some independence to call patients independently and then to review with you afterwards. Next slide. And then this is another really big one. A lot of my resident colleagues we've all been talking to each other, and particularly the PGY1s within my program are really worried about what virtual medicine means in regards of gaps in medical education. Because I think we're all on this call because we're so excited about virtual care, and we know that it leads to many different possibilities. But I don't think that any of us would disagree that virtual care is not 100% the same as a traditional clinic. And I think it's important that each different subspecialty thinks about what gaps are specific to you with virtual care. So for internal medicine, I was reflecting a bit and I thought of maybe two major gaps. So one that Dr. Youssef mentioned is physical exam skills. So yes, there are some really cool and unique physical exam tricks that we can do over virtual medicine. But if I'm a PGY1 learner and I go into a traditional cardiology clinic, my goal might be to learn how to identify an aortic stenosis murmur. And that'll be really hard if I'm in a virtual care clinic instead of a traditional clinic. One way that I've heard about addressing this is a learner mentioned this to their supervisor, and the supervisor set aside an hour each week to talk about a JAMA Rational Clinical Exam article. So, I mean, not identical, but really sort of putting in that extra effort to talk about physical exam skills. And then another thing that I've realized is over the past couple of months when I've been in virtual care clinics, I actually haven't had as much opportunity to teach others compared to a normal setting such as a clinical teaching unit. For internal medicine residents, usually in traditional settings, we're surrounded by other learners, and it's a really integral part of our learning to teach others, especially as senior learners. And with virtual care, I think that can be done, but it just requires more thought. So some examples of how you can incorporate that is some modalities like Zoom Health. You can have a separate sort of on the side room where a senior learner could actually chat to a junior learner and debrief about a consultation. There's a unique opportunity to actually record your consults with consent, and those recordings could be viewed by a couple of learners, and you can talk about pros and cons. Or you could do something more traditional where a PGY3 learner can be assigned to do a teaching topic via Zoom to a junior learner or a team, a healthcare team, at the end of the rotation. And then there's also unique opportunities for quality improvement. So as you're going through July and August, perhaps you can actually enlist some of those learners to create videos or educational topics via virtual care or about virtual care that other learners who participate in your clinic later on in the year can actually view and utilize. So those are my 5 tips based on my experiences on virtual care, and I hope that sort of brings you into the mind of a resident and is helpful for you.